Effectively controlling blood glucose requires lifestyle changes, especially in the areas of nutrition and physical exercise. And even when diabetes is well managed, illness can interfere with control. The role of medical nutrition therapy and exercise, and how to manage diabetes when an individual is ill, is the focus of this program. Medical nutrition therapy refers to the dietary management of diabetes that is provided by a registered dietitian, preferably a certified diabetes educator. An extremely important goal of this therapy for both type 1 and type 2 diabetes is to keep blood glucose levels as close to normal as possible to prevent or reduce the risk of diabetic complications such as nephropathy or cardiovascular disease. To keep blood glucose in this normal range, food intake must be balanced with physical activity, exercise, and often anti-diabetic medication, oral drugs, and/or insulin. Other important goals are to improve health through appropriate food choices and to achieve a lipid and lipoprotein profile that reduces the risk of macrovascular diseases such as heart attack and stroke, while taking into account the individual's personal and cultural food preferences, lifestyle, growth and development needs, and willingness to change. Attaining and maintaining a normal weight, too, is an important goal for most with type 2 diabetes. It is estimated that 80 to 90% of those with newly diagnosed type 2 diabetes have a body mass index in the overweight or obese range. Losing weight can reduce blood glucose, serum lipid levels, insulin resistance, and blood pressure, and can decrease the need for anti-diabetic medications. Even a modest weight loss of 10 pounds can significantly increase insulin sensitivity and decrease glucose production by the liver. Weight loss and regular exercise, of course, are also important ways to prevent metabolic syndrome and type 2 diabetes. Now that we know the goals, let's review some basic information regarding food sources. Carbohydrate is the body's primary energy source. Carbohydrates are found in breads and cereals, fruits, vegetables, milk, sweets, whole grain, rice, pasta, potatoes, corn, peas, beans, and lentils. Protein, the body's secondary energy source, is needed for tissue growth and repair. Animal protein sources include meat, eggs, and dairy products. Vegetable proteins are found in legumes, nuts, and seeds. Fat is a third energy source for the body. Animal fat sources include meat, egg yolk, and dairy foods containing fat. Vegetable fats are found in oils, nuts, seeds, and some high-fat fruits such as avocados. Trans-unsaturated fatty acids, or trans fats, are found in a variety of foods such as packaged cookies and crackers because they preserve the shelf life of the items. On food labels, they are designated as partially hydrogenated oils or fractionated oils. In essence, they are vegetable oils that are put through a process called hydrogenation to make products containing them harder and more resistant to spoilage. These fats are also present in margarine in varying degrees. The harder the margarine, the higher the trans fats. Although fiber, vitamins, minerals, and water do not contain calories, they are also essential because they are involved in many important body functions. Research has shown that people with type 2 diabetes who increase dietary fiber can lower their blood glucose and blood lipid levels. Foods containing soluble fiber, such as oatmeal, oat and rice bran, apples, dried peas and beans, barley, and fruits and vegetables, are most effective in lowering blood glucose. Meal planning by those who have diabetes is essential. The key to keeping the disease under control is emphasizing realistic and attainable goals that keep blood glucose at acceptable levels. New American Diabetes Association recommendations emphasize controlling the amount of carbohydrates in the diet rather than restricting certain types of carbohydrates. Carbohydrates should comprise between 45 and 55% of the diet. 20% of the diet should be protein, and less than 30% of daily caloric intake should be from fat. Less than 10% of calories should come from saturated fats, and intake of trans-unsaturated fatty acids should be minimized. To lessen stress on the kidneys, those with nephropathy should limit protein to 10% of the total daily intake. Counting carbohydrates to ensure a consistent daily intake is the preferred method for meal planning for persons with both type 1 and type 2 diabetes. One carbohydrate serving equals 15 grams of carbohydrates. One serving equals 1 slice of bread, 1 small potato, 1 small piece of fruit, 1 cup of non-fat milk, or 1 small cookie. A typical meal plan for a man with type 2 diabetes is 3 to 4 carbohydrate choices, or 45 to 60 grams of carbohydrate at each meal. When using a carbohydrate counting system, the person must learn some important basics, including the relationship between carbohydrate and blood glucose levels, which foods contain carbohydrates, what portion size equals 1 carbohydrate serving, and how to measure portion sizes accurately using tools such as measuring cups and food scales. Some individuals control their blood glucose by simply knowing which foods contain carbohydrates and how many servings to select for meals and snacks. Others, especially those using intensive insulin therapy, may use carbohydrate to insulin ratios. The physician prescribes the amount of insulin, usually rapid-acting insulin. A common ratio is 15 grams of carbohydrate to 1 unit of insulin. This means that for each 15 grams of carbohydrate, a patient will need to take 1 unit of their rapid-acting insulin. A registered dietitian converts the carbohydrate allowed in the diet into the number of portions and types of food the person prefers. The individual then administers the prescribed insulin dose just before eating his meal. Although protein and fat content of foods have less effect on blood glucose, they must be considered in meal planning as they contribute calories and can cause a delayed rise in blood glucose. The new recommendations also encourage the consumption of monounsaturated fats like olive, canola, and peanut oils. These types of oil have been shown to lower the levels of harmful low-density lipoproteins, or LDLs. The American Diabetes Association website contains valuable information about medical nutrition therapy for people with diabetes, including information about food portions, food exchange groups, sample menus, and guidelines about food selection when eating out. A special feature of the website called the Virtual Grocery Store helps those with diabetes make appropriate food choices and get feedback about their shopping habits. In recent years, some researchers have been focusing their attention on the glycemic index of carbohydrates, This is a ranking of carbohydrates according to how rapidly they turn into glucose. Some carbohydrates, such as potato, cause blood glucose to rise quickly, thus they have a high glycemic index. Other carbohydrates, such as black beans, have a more gradual effect on blood glucose and have a lower figure. Some recommend that those with diabetes avoid foods with a high glycemic index. Nutritional recommendations by the American Diabetes Association state that with regard to the glycemic effect of carbohydrates, the total amount of carbohydrate in meals or snacks is more important than the source or type. To review, medical nutrition therapy is vital in managing diabetes and preventing complications in those with both type 1 and type 2 diabetes. Effective strategies include eating a variety of foods, counting carbohydrates, being aware of portion sizes, eating monosaturated fats, and increasing dietary fiber. Some also advise avoiding foods with a high glycemic index. Physical exercise is another essential aspect of management of diabetes. The benefits are immense. For example, it is important in helping to achieve optimal blood glucose control and a vital factor in reducing the risk of cardiovascular disease, a cause of much of the morbidity and mortality associated with diabetes. Exercise helps lower blood glucose levels by increasing insulin sensitivity and helping muscles use glucose more efficiently. In addition to lowering blood glucose, exercise stimulates weight loss, reduces blood pressure, improves lipid profiles, increases muscle strength and flexibility, and promotes a sense of well-being. Research shows that people with type 2 diabetes who exercise regularly lose weight and decrease their risk of developing cardiovascular disease. Regular exercise also helps decrease the hemoglobin A1C level, a measurement of mean blood glucose over several months. Aerobic exercise that involves major muscle groups and requires oxygen for muscular effort produces the greatest health-related benefits. There are, however, certain exercise precautions that those with diabetes should observe. Before starting an exercise program, individuals should, of course, be assessed for existing diabetic complications. Those at increased risk for exercise-related complications include persons who are over age 35, those who have had type 2 diabetes for more than 10 years, or type 1 diabetes for more than 15 years, as well as those with cardiovascular disease, peripheral vascular disease, neuropathy, nephropathy, and retinopathy. It is especially important for a person with retinopathy to be assessed by an ophthalmologist before starting an exercise program because retinal detachment and potential permanent blindness can occur with some activities if the person has proliferative retinopathy. Those with severe proliferative retinopathy should avoid activities such as weightlifting or resistance exercises that increase systolic blood pressure, and participating in strenuous activities and high-impact exercises such as jogging or sports that cause head jarring, such as hitting a soccer ball with the head. However, people with this form of retinopathy can benefit from low-impact activities and exercise that provides cardiovascular conditioning, such as swimming, walking, low-impact aerobic dancing, and stationary cycling. Taking preventive measures to protect the feet during physical activity are also essential. Wearing properly fitting footwear, keeping the feet dry, and inspecting for blisters or other foot damage during and after exercise are important strategies to prevent foot infection. A foot specialist should be contacted immediately if problems are detected. Additional exercise precautions include starting an exercise program slowly and working up to a more intensive program, maintaining hydration by drinking sufficient fluids before, during, and after exercise, and a warm-up and cool-down period. Preventing exercise-induced hypoglycemia is also important. Hypoglycemia during or after exercise can occur in individuals who are treated with insulin or oral drugs that stimulate the pancreas to produce more insulin. Hypoglycemia from exercise can occur as much as 12 to 24 hours after exercise. Healthcare providers should teach those starting an exercise program about exercise-related hypoglycemia and what medication and food adjustments to make to prevent it. Before exercising, it is important for the person to check the blood glucose level, to have a snack of approximately 15 grams of carbohydrate if the level is less than 100 milligrams per deciliter, and to wait until the blood glucose is greater than 100. It is also important to eat a snack high in carbohydrate when the exercise session exceeds an hour, and to monitor blood glucose during and after exercise. Those who use insulin or oral drugs that can cause hypoglycemia should carry a carbohydrate source, such as glucose tablets, with them, and should have diabetes identification. And they should exercise with a partner if possible. To review, exercise helps lower blood glucose levels, stimulates weight loss, reduces blood pressure, improves lipid profiles, increases muscle strength and flexibility, and promotes a sense of well-being. Special precautions may be necessary for those over age 35 who have had the disease for a number of years, who have complications such as cardiovascular disease or proliferative retinopathy, and those at risk for hypoglycemia. Sick day management is an essential skill for those who have diabetes. Let's first examine the effects of illness on those with diabetes. During illness, there is an increase in the secretion of counter-regulatory hormones such as cortisol and epinephrine. Counter-regulatory hormones raise blood glucose levels by causing the glycogen stored in the liver to break down into glucose for release into the bloodstream, by increasing insulin resistance, and by inhibiting the uptake of glucose by muscle tissue. Unable to use glucose as an energy source, the body of someone with type 1 diabetes begins to break down fats. Byproducts of this breakdown include ketones and free fatty acids, products that can eventually lead to acidosis. In addition, as blood glucose continues to rise, glucose molecules spill into the urine. The osmotic pressure created by this glucose results in the loss of water and electrolytes as well. Adequate insulin replacement must then be given to lower blood glucose and to treat diabetic ketoacidosis, a critical situation most often seen in those with type 1 diabetes. In individuals with type 2 diabetes, a potentially life-threatening condition known as hyperosmolar hyperglycemic state, or HHS, can occur due to the high blood glucose level and dehydration. Because the consequences of illness can be so dire in those with diabetes, sick day management is a survival skill that they must learn. When ill, however, many persons are fatigued and sleepy, making self-care more difficult. Therefore, family members or significant others must also be familiar with sick day guidelines and know where sick day instructions and supplies are kept. There are 4 important principles for sick day management: maintaining adequate hydration and eating adequate carbohydrates, monitoring blood glucose and ketones, continuing anti-diabetic medications, and knowing when to call a healthcare provider. First, it is vital to maintain adequate hydration to prevent dehydration from decreased fluid intake, polyuria, vomiting, diarrhea, and evaporative fluid losses from fever. To promote hydration, people with diabetes should drink at least 8 ounces of calorie-free or almost calorie-free fluids every hour while awake. This includes water, diet soft drinks, and broth. Because caffeine acts as a diuretic, the fluids consumed should be caffeine-free. Fluids containing sodium and other electrolytes, such as bouillon and consommé, should be consumed every 3 hours. Eating approximately 200 grams of carbohydrates per day in evenly divided doses and sufficient injected insulin is usually sufficient to prevent ketosis. Foods such as 1/3 cup apple juice, 1 popsicle, 1 slice dry toast, 6 saltines, 4 ounces of regular soda or Gatorade, or 1/2 cup regular ice cream all contain approximately 15 grams carbohydrates and are appropriate for sick day use. If the person is unable to tolerate usual foods at meal times due to nausea or anorexia, clear liquids or soft foods are useful. Blood glucose should be monitored every 2 to 4 hours while glucose levels are elevated and/or until symptoms subside. Blood or urine ketone levels also need to be tested every 4 hours until negative results are obtained. This is especially important for those with type 1 diabetes. The person should continue anti-diabetic medications. Insulin and most oral agents are still needed during illness, even when the person is unable to eat. One exception is glucophage, metformin. If the patient is at risk for dehydration, this drug should be stopped due to the risk of lactic acidosis. Because omitting or reducing the amount of insulin during illness is a common cause of ketoacidosis, those on insulin should take a full dose of it. Supplemental doses of rapid-acting or short-acting insulins may also be prescribed on a sliding scale basis for continuously rising or permanently elevated blood glucose levels or ketones. Finally, people with diabetes and their families or significant others must know when to call their healthcare providers. Immediate contact with a healthcare professional should occur when the person has difficulty breathing, vomits more than once, has more than 5 episodes of diarrhea or diarrhea lasting more than 6 hours, has blood glucose levels higher than 300 milligrams per deciliter on 2 consecutive measurements that are unresponsive to increased insulin and fluids, or has moderate or large urine ketones. To review, keeping hydrated, eating adequate carbohydrates, monitoring blood glucose carefully, continuing anti-diabetic medications, increasing insulin if needed, and knowing when to contact healthcare providers are key factors in preventing complications when ill. Teaching persons with diabetes and their families the principles of medical nutrition therapy, the benefits of exercise and precautions to take, and how to manage diabetes on sick days are essential components for effective disease management.